Larynx. In this video, we'll cover the following key topics about the larynx. 1. Introduction. 2. Cartilages of the larynx. 3. Joints of the larynx. 4. Ligaments and membranes. 5. Muscles of the larynx. 6. Nerve supply of the larynx. 7. Arterial supply of the larynx. 8. Venous drainage of the larynx. 9. Lymphatic drainage of the larynx. Before we begin, make sure to subscribe to my channel for more updates on anatomy and health topics. 1. Introduction. The larynx is the upper expanded part of the lower respiratory tract. It is also called voice box or organ of phonation. It acts as a sphincter at the inlet of lower respiratory tract to protect the trachea and the bronchial tree from entry of any material other than the air. The larynx is situated in the anterior midline of the upper part of the neck, in front of laryngopharynx. It extends from the root of the tongue to the trachea and lies in front of the 3rd, 4th, 5th, and 6th cervical vertebrae. Cartilages of larynx. Larynx consists of a series of cartilages which are connected to one another by ligaments and fibrous membranes and moved by a number of muscles. There are totally 9 cartilages, of which 3 are unpaired and 3 are paired. Unpaired cartilages. The unpaired cartilages are large and comprise thyroid, cricoid, epiglottis. Paired cartilages. The paired cartilages are small and comprise the principal cartilages of the larynx are cricoid, thyroid, and 2 arytenoids. Thyroid cartilage. It is most prominent and acts as a shield to protect the larynx from the front. It is consisting of 2 quadrilateral laminae, which meet in front at an angle called thyroid angle. The posterior surface of the thyroid cartilage in the median plane provides attachment from above downward to following structures: thyroepiglottic ligament, a pair of vestibular ligaments, a pair of vocal ligaments. The posterior border of each lamina is free and prolonged upwards and downwards as superior and inferior horns cornu. It provides conjoined insertion to the following 3 muscles: palatopharyngeus, salpingopharyngeus, stylopharyngeus. The outer surface of each lamina presents an oblique line and provides attachment to the following 3 muscles: from above downwards and from medial to lateral sides. These are as follows: thyrohyoid, sternothyroid, inferior constrictor, cricoid cartilage. This is a signet-shaped ring of cartilage with a narrow anterior arch and a broad posterior lamina. The cricoid cartilage is situated at the level of the 6th cervical vertebra and completely encircles the lumen of the larynx. It is considered as the foundation stone of the larynx. The posterior surface of lamina presents a median ridge and 2 depressed areas on each side of this ridge. Epiglottis. It is leaf-like and extends up behind the hyoid bone and the base of the tongue. Its broad upper end is free and forms the upper boundary of the laryngeal inlet, while the lower end, stalk, is pointed and connected to the posterior surface of the angle of the thyroid by thyroepiglottic ligament. The anterior surface of epiglottis is connected with the base of the tongue by median and lateral glossoepiglottic folds. The depression on each side of the median fold is called vallecula. The posterior surface of epiglottis presents a tubercle in its lower part. Arytenoid cartilages. The paired arytenoid cartilages articulate with the lateral parts of the upper border of cricoid lamina. Each arytenoid cartilage is pyramidal and presents an apex, base, three surfaces, posterior, anterolateral, and medial, and two processes, muscular and vocal. The muscular process projects laterally and backwards, whereas the vocal process is directed forwards. The base of arytenoid cartilage is concave and articulates with the upper border of the lamina of cricoid cartilage. The base is prolonged anteriorly to form the vocal process and laterally to form the muscular process. The apex is curved posteromedially and articulates with the corniculate cartilage. Corniculate cartilages of Santorini. These are two small conical nodules which articulate with the apices of the arytenoid cartilages. They are directed posteromedially and lie in the posterior parts of the epiglottic folds. Joints. Cricothyroid joint. It is a plain synovial joint between the inferior cornu of the thyroid cartilage and side of cricoid cartilage. This joint permits two types of movements. Rotatory movement, in which cricoid rotates on the inferior cornua of the thyroid cartilage around a transverse axis, which passes transversely through both cricothyroid joints. Gliding movement, in which cricoid glides, to a limited extent, in different directions of the thyroid cornua. Cricoretinoid joint. It is a tiny plain synovial joint between the base of the arytenoid and lateral part of the upper border of the lamina of cricoid cartilage. This joint permits two types of movements. Rotatory movement, in which arytenoid cartilage moves around a vertical axis, thus abducting or adducting the vocal cords. Gliding movement, in which one arytenoid glides towards the other or away from it, thus closing or opening the posterior part of glottis. Arytenocorniculate joint. It is a synovial joint between the arytenoid and corniculate cartilages. It is of no functional significance. Ligaments and membranes. Extrinsic ligaments are the extrinsic ligaments and membranes are outside the inner tube of the fibroelastic tissue of laryngeal cavity, thyrohyoid membrane, and ligaments. The thyrohyoid membrane extends from the upper border of the thyroid cartilage to the upper border of the hyoid bone. It ascends behind the concave posterior surface of the hyoid bone. Between posterior aspect of hyoid and membrane lies the subhyoid bursa. In the median and lateral parts, the thyrohyoid membrane thickens to form median and lateral thyrohyoid ligaments. The lateral thyrohyoid ligament on each side contains a small nodule of elastic cartilage called cartilagotriticea. The thyrohyoid membrane is pierced on either side by internal laryngeal nerve and superior laryngeal vessels. Cricotracheal ligament. It connects the cricoid cartilage with the first tracheal ring. Thyroepiglottic ligament. It attaches the lower narrow end of epiglottis to the posterior surface of thyroid angle. Hyoepiglottic ligament. It connects the posterior aspect of hyoid with the anterior surface of the upper end of epiglottis. Cricothyroid ligament. It connects the lower border of the thyroid cartilage to the cricoid cartilage in the midline. Intrinsic ligament. The intrinsic ligaments and membranes are the parts of a broad sheet of fibroelastic tissue, which forms the inner tube of the laryngeal cavity outside its mucous lining. This fibroelastic tube is, however, interrupted on each side by the sinus of the larynx. The part above the sinus is called quadrate or quadrangular membrane, and part below the sinus is called cricovocal membrane or conus elasticus. Cricovocal membrane extends upwards and medially from the upper border of the arch of the cricoid cartilage. Its upper edge is free and attached anteriorly to the posterior surface of the thyroid cartilage and posteriorly to the vocal process of the arytenoid cartilage. It is slightly thickened to form the vocal ligament. The fold of mucous membrane over this ligament forms the vocal fold. Vocal ligament is made up of yellow elastic tissue and extends antero-posteriorly from posterior surface of the thyroid cartilage to the vocal process of arytenoid's cartilage. Quadrangular membrane extends from sides of epiglottis to the arytenoids. Its lower edge is free and attached anteriorly to the posterior surface of the thyroid cartilage, above the cricothyroid membrane, and posteriorly to the lateral surface of the arytenoid cartilage, in front of muscular process. Its lower edge is thickened to form the vestibular ligament. Vestibular ligament is made up of fibrous tissue and extends antero-posteriorly from posterior surface of the thyroid cartilage to the lateral surface of the arytenoid cartilage. Muscles. They are of two types, extrinsic and intrinsic. Extrinsic muscles are: they attach the larynx to the surrounding structures and are responsible for the movement of the larynx as a whole. All the extrinsic muscles are paired and include palatopharyngeus, salpingopharyngeus, stylopharyngeus, thyrohyoid, sternothyroid. All these muscles elevate the larynx except sternothyroid, which depresses the larynx. Intrinsic muscles are: they attach the laryngeal cartilages to each other and are responsible for their movements. Their main functions are to open or close the laryngeal inlet, adduct and abduct the vocal cords, and increase or decrease the tension of the vocal cords. Thus, according to their actions, intrinsic muscles of the larynx are arranged into the following groups. Muscles that open or close the laryngeal inlet: oblique arytenoids. Ari epiglotticus closes the inlet of larynx. Thyroepiglotticus opens the inlet of larynx. Muscles that abduct or adduct the vocal cords: posterior cricoarytenoids abduct the vocal cords. Lateral cricoarytenoids adduct the vocal cords. Transverse arytenoid adduct the vocal cords. Muscles that increase or decrease the tension of vocal cords. Cricothyroid tenses the vocal cords. Vocalis tenses the vocal cords. Thyroarytenoid relaxes the vocal cords. Cricothyroid muscle. It is the only muscle of the larynx which lies on the external surface of the larynx. It is a small fan-shaped muscle, which arises from the anterolateral aspect of the cricoid. After origin, its fibers pass backwards and upwards to be inserted into the inferior cornu and adjacent lower border of the lamina of the thyroid cartilage. It is supplied by external laryngeal nerve. Its contraction makes the thyroid cartilage to tilt slightly downwards and forwards at the cricothyroid joints, thereby lengthening and tensing the vocal cord. It also helps in adduction of vocal cord. The whole thyroid cartilage can move downwards and forwards over the cricoid like the visor of a knight's helmet. Grant. Vocalis muscle. It is the detached medial part of the thyroarytenoid and lies within the vocal fold, just lateral and cranial to the vocal ligament. It arises from the thyroid angle and anterior part of vocal ligament and inserted into the lateral surface of the vocal process. On its contraction, the anterior part of vocal ligament tenses, whereas its posterior part is relaxed. It is supplied by the recurrent laryngeal nerve. The segmental tension of vocal ligament helps in the modulation of voice, like the fingers of a violinist. Posterior cricoarytenoid. It is a triangular muscle which arises from the posterior surface of the cricoid lamina lateral to its median ridge. After origin, the fibers pass upwards and laterally to be inserted into the back of the muscular process of the arytenoid. It is supplied by recurrent laryngeal nerve. The posterior cricoarytenoid abducts the vocal cords. Nerve supply. All the intrinsic muscles of the larynx are supplied by recurrent laryngeal nerve, except cricothyroid, which is supplied by the external laryngeal nerve. Nerve supply of the larynx. Motor nerve supply. It is provided by internal and external laryngeal nerves. Sensory nerve supply. The mucous membrane of larynx above the vocal folds is supplied by the internal laryngeal nerve, while below the vocal folds by the recurrent laryngeal nerve. Arterial supply of the larynx. The arterial supply of larynx is as follows. Above the vocal fold, by superior laryngeal artery, a branch of superior thyroid artery. Below the vocal fold, by inferior laryngeal artery, a branch of inferior thyroid artery. Venous drainage of the larynx. The veins draining the larynx accompany the arteries. These are superior laryngeal vein, which drains into the superior thyroid vein. Inferior laryngeal vein, which drains into the inferior thyroid vein. Lymphatic drainage of the larynx. Above the vocal cords, pierce the thyrohyoid membrane. Run along superior thyroid vessels and drain into upper. Below the vocal cords, pierce the cricothyroid membrane and go to the prelaryngeal and pretracheal nodes, and then drain into lower deep cervical lymph nodes, postero-inferior group. Thank you for watching. We hope this video helped deepen your understanding. Stay curious and keep learning.